how have you perfected your skill as a surgeon and utilized technology through those years?
Well, I think the most important thing is in surgery is just the minimal tissue dissection that we now do that we did many years ago. And that has really helped, I believe, the patient tremendously, because where you might have done a back surgery that would keep a patient in a hospital for 4 or 5 days, you can often do as an outpatient.
You mentioned microsurgery. How has that evolved over the last?
Well, the idea is to get more or I should say less and less tissue disruption. The idea is to do the operation with as minimal tissue disruption as possible.
So when you do that, you see more efficient outcomes, you see patients leaving the hospital sooner. Talk to me about that.
Correct,
So,
with less what we would term morbidity. They have less complications, they have less pain, they have less chance of developing further problems. So everything you do is always geared towards improvement, improvement, improvement. And the diagnosis. They need to understand what their options are. In other words, doctor, what if I do nothing? What's the natural history of this problem if I do nothing? The second is, what can you do for me medically? And then the other and final issue is surgery, depending upon the risks and the benefits of that operation.
do you have any observations about the field of neurosurgery and how it's changed during the last 20 years? Is there any, ways that you feel you've perfected your surgical craft, or could you just talk to me a little bit about surgery in general?
Well, the technology has changed tremendously in terms of the way we do brain surgery with neuro-navigational guidance.
Could you explain what that is?
Well, if you have a brain tumor, and we used to take all these measurements from the skull in order to localize our incision, now we have technology with MRIs that we are performed before surgery that allow us to localize exactly where we want to be at the time of surgery. The same with the guidance of the spine and the ability to use instrumentation in the spine that was not available to us. The more minimally invasive techniques, the microscopic techniques. I think the technology is much different than it was 27 years ago when I started, and I think that's the beauty of the field. It's changing, it always changes. And obviously the hope is as it improves, and now you have all the microbiology and all the research and all the genetic research that is going into the treatment of diseases. I mean, this is a fascinating time.